The normal heartbeat is controlled by electrical signals from the sinus node that proceed downwards inside the heart. The impulse causes the right and left atrium to contract after inflow of blood and to pump the blood into the right and left ventricles. These also contract afterwards and forward the blood into the body's circulation system. Atrial fibrillation is the most abnormal heart rhythm. Fibrillation is an abnormally fast and chaotic heartbeat. As a result, the atria can't contract efficiently and blood cannot be pumped into the ventricle completely, but remains longer in the atrium, especially in a so-called left atrial appendage. This is a small protrusion without function. Blood pooled in the atrial appendage can clump and form blood clots that can enter the circulation system when detaching and block the blood supply in the brain and lead to a stroke. 90% of strokes in atrial fibrillation are caused by blood clots formed in the left atrial appendage. Thus, closing off the left atrial appendage is an effective alternative for stroke prevention to the standard therapy with so-called oral anticoagulants. This can be done, for example, with the Watchman LAA closure device. It consists of a nitinol frame with fixation anchors and is covered with a thin membrane. It is available in 5 sizes to accommodate the individual anatomy of the patients. And this is how the minimally invasive implantation procedure works. Watchman is implanted during a 1-hour procedure via the femoral vein. During the procedure, which can be done either under general or under local anesthesia, the access sheath and dilator are advanced to the atrial appendage via a guide wire. After the correct size has been determined using echocardiography, the catheter with the device is advanced to the left atrial appendage via the access sheath. There the implant is released, its correct position verified via echocardiography and X-ray, and the catheter will be removed. Within the next weeks, the membrane of the device will be enclosed by tissue which closes off the left atrial appendage for the long term. This means that the primary source of stroke in atrial fibrillation is diminished. After the implantation, patients have a first follow-up at 45 days. During this visit, it is checked using ultrasound method whether the device has been covered completely by the surrounding tissue, and by that, the left atrial appendage closed. A further follow-up takes place at 6 months after the procedure. More than 90% of the patients with an implanted Watchman device don't need long-term treatment with oral anticoagulants. These, as well as the Watchman LAA closure device, do not treat atrial fibrillation itself, but reduce the risk of stroke in atrial fibrillation.